Hello, everybody. It is good to see you on this wonderful but chilly Wednesday afternoon. Hello, Jim, Jenna, Lisa, Alyssa, John, and Catherine. Good to see you all back again. Y'all are very dedicated, long-time people. Same thing to you, Denise. I'm sorry, I jumped right over your name. Good to see everybody. Welcome, Ambria. I am very grateful for your support of the channel. We are going to be getting started in just about a minute. Good morning. Okay, we are going to be getting started in just about a minute on this presentation on POTS, Postural Orthostatic Tachycardia Syndrome. And I'm probably not going to say that longhand multiple times because for some reason I find it to be a tongue twister. But I am glad that there are some people, X1435, who are here because it's something that is near and dear to their heart, just like it is to mine, because my daughter has it. I don't have this one, but my daughter does. And we struggled for years trying to get an accurate diagnosis for her. So let's go ahead and get started with no further ado. I'd like to welcome everybody to today's presentation on Beyond the Fog, a clinician's guide to POTS and autonomic dysregulation. I'm your host, Dr. Dawn-Elise Snipes. Did you know that 1 in 15, or about 1 in 15 high school students may struggle with dizziness, brain fog, chronic pain, poor school performance, and what looks like to many of us, anxiety, ADHD, or just oppositional behavior? But it's not. This is a huge problem. And if you're a teacher, if you're a pastor, if you're a parent, if you're a counselor, listen up, because there are a lot of people, a lot of young people who are going undiagnosed and feeling very invalidated because of what they're going through. Today, we're going to distinguish POTS from anxiety and behavioral disorders using core autonomic features, explain how posture and sympathetic activation impair cognition in POTS, identify common co-occurring conditions and symptom triggers associated with POTS, that's important, recognize the functional impact of POTS across all pieces of life, physical, interpersonal, emotional, cognitive, and environmental, and apply evidence-based supports and accommodations to reduce autonomic load and help improve people's quality of life. POTS is short for, and this is probably the only time I'm going to say it long form because I get tongue-tied, Postural Orthostatic Tachycardia Syndrome. It is a common chronic autonomic nervous system disorder that's frequently misdiagnosed. Now remember, we've talked a lot in other videos about the ANS, the autonomic nervous system. The autonomic nervous system is comprised, of the parasympathetic nervous system, which is your rest, digest, and repair, and the sympathetic nervous system, which is fight or flight. Unfortunately, in POTS and other autonomic disorders, those two systems don't work well together. And in many cases, the sympathetic nervous system is way overactive. Symptoms of POTS are invisible. You're not going to see them unless you are looking at a heart rate monitor or a blood pressure monitor, and even blood pressure is a little bit dicey. They're fluctuating and context dependent. Well, they fluctuate based on how much other stress on the sympathetic nervous system is going on. When people have a lot of stress in their life in general, then their POTS symptoms are generally worse because POTS typically just increases the demand on the sympathetic nervous system. And when I say other sources of stress, remember that can be in any piece of life. Physical stress, interpersonal stress, emotional, cognitive, or environmental. Temperature is a huge thing, as well as posture and body positioning for adding extra stress to the body of a person who has POTS. Misinterpretation of the overt symptoms like shakiness, dizziness, fatigue, poor concentration leads to academic and occupational decline. People are told you just need to focus harder. You need to get better sleep. You need to blah, blah, blah. They are doing what, unfortunately, a lot of people do when they're trying to help, and they start telling you what you should do instead of figuring out what the problem actually is. It also leads to behavioral labeling, such as hypochondriac or lazy or sloppy work, and can increase anxiety, depression, and shame. Well, obviously, if people are criticizing you and telling you you can do better, and you're doing your very darn best, yeah, it's going to be problematic and start really impacting self-esteem, self-efficacy, interpersonal relationships, etc. Research has repeatedly shown outcomes improve with validation, accommodation, and predictability. So it's not enough just to say, okay, this is what's going on. We need to validate that, yes, your experience is real. It's not all in your head. We need to help people find accommodations, and we'll talk about askjan.org at the end. And we need to help them have predictability. Why? Because lack of predictability increases stress, which can increase symptoms. Why POTS is often missed? Well, symptoms overlap with anxiety, ADHD, depression, and just what some call a lack of motivation. And that's really important. Can someone with POTS have ADHD? Certainly. You can have co-occurring issues, but it's not enough just to give the diagnosis of ADHD, anxiety, or depression if the person meets those criteria without first or concurrently ruling out biological causes of what's going on. And I will tell you, it was terrifying for me as a parent, and I can only imagine how much more terrifying it was for my daughter when she developed POTS and she got to the point where she couldn't stand up in the shower and wash her hair without passing out. That's kind of a big thing. It was terrifying to see my little girl go from being a cross-country runner to barely being able to get off the couch seemingly overnight. And yes, initially I prodded her a little bit because I didn't know any better. And we went to the doctor. The doctor was just like, no, she had a virus. She'd been in bed for 2 weeks. And the doctor was like, oh, this is just deconditioning from the virus and a little bit of leftover fatigue. This was long before 2020. So, and the doctor explained away her symptoms as remnants from that virus and deconditioning that would go away with time and with getting back into the gym. Well, it didn't. It only got worse. Diagnostic tests that your GPs, your ARNPs, and I'm not dissing them on this, it's just the way it is. Diagnostic tests often underestimate the functional impairment. They can say, yeah, your heart rate goes way up when you stand up, but hey, your blood pressure is not going down. It doesn't really point out all of the ways, and we're only going to hit on some of them today, that POTS impacts a person's ability to function in day-to-day life. Performance inconsistency at work, at school, at home, doing chores, in relationships is often misread as avoidance, noncompliance, effort problems, some sort of behavioral issue. And that's not it. Most people with POTS are doing the very best they can, and it's a moment by moment, hour by hour decision on what can I do right now without falling out. Functional decline, unfortunately, often precedes diagnosis, which is exactly what we saw in my daughter's case. Now, this was back in 2017, but remember I said the doctor said, oh, once she gets fully over the virus and gets back into the gym, everything will be fine. Well, that wasn't the case. And she had to get to the point where, we'd been back to the doctor a couple of times, not doing anything. We switched doctors. Finally, we found one doctor who said that this is what I see may be going on. And she called it POTS. And it was a revelation. It was like, somebody had suddenly turned the lights on, which was so wonderful for us at that point. Now, back in 2017, they were just starting to learn about POTS, so there was still a long way to go. But unfortunately, she had to get to the point where she could barely get out of bed before we had a doctor acknowledge that she wasn't malingering. She wasn't trying to avoid schoolwork. She wasn't depressed. She wasn't clinically anxious. She was sick. POTS is a chronic disorder of the autonomic nervous system. Remember, it's the balance between rest and digest and your sympathetic nervous system or your stress response. It is defined as excessive heart rate increasing 30 to 40 beats a minute within 10 minutes of standing without a decrease in blood pressure. And there are different types of POTS we'll talk about in a minute. But the big thing is to recognize, and you can do this for yourself if you don't have POTS, take your pulse, or if you've got a exercise tracker, look at what your pulse is when you're sitting down, and then stand up and look at what your pulse does. It will generally go up a few beats a minute because you just use some big muscles, but it does not go up anywhere near 30 to 40 beats per minute just because you stood up. Think about how much energy that takes the body to shoot the stress system into the stratosphere and shoot the heart rate 30 to 40 beats a minute up. I mean, even when I work out, it takes a minute for me to get my heart rate from 80 to 120, which is a 40 beat per minute increase. So I can only imagine how it must have felt like an elephant sitting on her chest and trying to bust its way out every time she stood up. It's exhausting. POTS impairs regulation of circulation, which also impacts cerebral blood flow. And we're going to talk a lot about brain blood flow today, because blood and oxygen that's in that blood pools in the lower extremities. So it's not getting up to the brain to feed or to power thinking and cognitive thought. And when the brain doesn't have enough blood and oxygen, guess what? The body perceives it as a stressor and triggers that stress response even more. It impairs the regulation of oxygen because blood carries oxygen. If the blood's sitting down in your feet, it ain't doing much for the rest of your body. And it impairs the regulation of the autonomic nervous system. As I mentioned, if the body's not doing what it needs to do to feed all of the different areas, the brain registers that as a stressor, which will eventually potentially lead to sympathetic dominance. So what we see in a lot of people with POTS is something called poor vagal tone. Their sympathetic nervous system, their stress response is really strong, but their ability to turn off that stress response or to blunt that stress response with the parasympathetic nervous system is very poor. The vagus nerve just doesn't kick into gear. And we will talk about vagal strengthening exercises later. Symptoms are physiologic, not psychological. And I want to put an important caveat here because it is extremely stressful and can provoke a lot of anxiety, health anxiety, in people that both have it and loved ones of people who have it. So it is very possible to have POTS and adjustment disorder or anxiety disorder. However, anxiety disorder itself, if somebody has it in addition to POTS, is not going to improve, or at least not completely improve, until the POTS is addressed. If the heart rate is still just doing its own thing, it leaves the person feeling very unstable. Because when your heart rate starts to go up, when your blood pressure doesn't go down, you start getting dizzy, start feeling faint. And the only way to fix that for a lot of people is to lay flat on their backs. POTS is not a panic or an anxiety disorder. Again, because of invalidation, poor diagnosis, difficulty with symptom management, some people may develop a concurrent anxiety or depressive disorder. But POTS itself is not an anxiety disorder. It's not a somatic symptom disorder. What's going on is actually happening. We're not just thinking something's going on in the body. We're not just triggering it through an emotional reaction. The body's misbehaving. It's not malingering or attention seeking. A lot of people that know somebody with POTS don't really understand what's going on. There was a young woman that was our waitress at a restaurant, and she came, she got us our drinks and everything, and then she disappeared. And I was like, well, maybe she went on break. I don't know, but service was not that good. She came back later and apologized for not bringing us our food herself because she had passed out in the back. She had been up on her feet working as a waitress for too long. That's really hard on people with POTS. And it was hot back in the kitchen. She got overheated. She fell out. As soon as she said that, I was like, do you have POTS? And she said, yeah. And I said, all right, I get it. My daughter has that. And it seemed to make her feel a little bit better that she wasn't being judged, that, I kind of got it. But a lot of other people that she was serving probably didn't. POTS is not fixed by just pushing through, by just getting up, moving, reconditioning. No, that doesn't fix it. If anything, a lot of times it makes it worse because it adds extra cognitive, emotional, and physical stress on the person if it's not done correctly. And it's not simply deconditioning. After you have been on bed rest for whatever reason, you've deconditioned. And it may feel like it takes a lot more energy to go up the stairs. It may feel like it takes a lot more energy to do your general house cleaning or activities of daily living. That's true. But the body snaps back pretty quickly in a healthy system. In someone with POTS, yes, they have deconditioned because the symptoms have made it nearly impossible to do a lot of physical activity, but it's not just deconditioning. Deconditioning is a secondary symptom of POTS itself. And yes, it needs to be addressed eventually, but that's down the line. And that is something that only a doctor and or physical therapist should work with the patient on, because it is so easy to give bad information about conditioning, reconditioning, etc. to somebody, especially to somebody with an autonomic disorder. Psychologizing, trying to make this all in your head, number one, is invalidating. Number two, it delays care, which lets the nervous system physically get further out of whack. It increases shame and disengagement and worsens that autonomic instability. Why does the heart rate increase? Well, when you stand, or sometimes when you sit, some of us that don't have the best circulation in the world, when you sit, especially if you cross your legs, your lower legs turn blue. Well, that's blood pooling in your lower legs, okay? People with POTS, the blood pools in their lower extremities. Where do we need blood? We need blood in our heart. We need blood to our lungs. We need blood to our brain, and it ain't getting there. So what happens? The brain says, this isn't good, and it ramps up the stress response. Why? Because that increases the force and speed of heart contractions, so it pulls that blood up from the bottom, pulls that blood up from the lower extremities. Many people with POTS, they have laxity in their capillaries, especially in their lower extremities. So unlike a person who doesn't have POTS, where those capillaries just contract and push the blood back up, their capillaries really struggle. They're too weak. They can't do it, which is one of the reasons that a lot of doctors recommend wearing compression garments, because that helps push the blood back up. Again, something that should only be undertaken after approval from a doctor. So tachycardia, that heart rate going up really fast, it's compensatory. It's not driven by panic in the emotional sense. It's driven by the brain going, y'all, we need to get some fuel up here to the brain. And I don't know why my brain is always Southern, but it is. Anyhow, how common is it? POTS affects about 1% of the general population. People can get POTS or develop a POTS diagnosis into their 40s and 50s. So it's not just a disorder of people who are young. 1 to 3 million people in the U.S., and that is a gross underestimate, 1 to 3 million people in the U.S. currently are known to have POTS. They expect it's a lot higher, and that a significant proportion of people with POTS are misdiagnosed with either anxiety disorders, ADHD, or panic disorder. Up to 1 in 15 female teens has POTS. Wow. Okay. So one of the things they found is that as people move into puberty, or move out of puberty, I guess, for many, there are notable improvements in POTS symptoms. Does it mean that POTS is all gone, that you just, quote, grow out of it? No, not necessarily. Most people will have some residual symptoms and have to monitor their stress levels. However, symptoms do dramatically improve for a lot of people with POTS once their hormones aren't all over the place, hither and yon, like they are during puberty. However, 1 in 15 teen females, which means 1 in 15 females that are in high school and college, have POTS. That means 1 in 15 females who are in high school and college start to have some level of cognitive decline after about 20 minutes of sitting in class. So think about how that's impacting their ability to learn and their functioning on tests. People who have POTS do not do well if they have to take a long test like the ACT or the SAT, because their cognition declines so quickly. People with POTS may struggle with driving or even riding in a car, but driving especially, because you have to be mentally sharp and situationally aware when you're driving. But if your cognitive abilities start to go down after 20 minutes and you're driving the car, it can be really dangerous. And there are a lot of people with POTS who have recognized that it is not safe for them to drive more than, 2 or 3 miles up the street and back. And that is very paralyzing as an adult, as a, young adult, older teenager. That can feel very paralyzing and sometimes demoralizing. Recognizing that as a clinician, as a support person, and not making somebody feel bad for not being able to drive them around. There's a lot of guilt associated with POTS because people with POTS often feel like they're a burden. We'll get to addressing that in a few minutes. I've gotten off topic. The typical age of onset is between 12 and 19. However, as I said, some people can have onset into their 40s and 50s. Gender bias increases mislabeling POTS as anxiety in females and depression in males, leading to underdiagnosis. And I did mention ADHD and ADD before. Most of the time, the symptoms overlap with ADD more than ADHD. Most people with POTS are not hyperactive. They have everything they can do to keep going because just existing is exhausting. Most individuals with POTS have overlapping mechanisms going on. Hypovolemia, that means they have too little blood in their body. And that can be, for a lot of them, the hormones that we have in our body that are supposed to regulate salt and fluid levels to keep the correct amount of blood in our system. People with POTS, that system's on the fritz. So they often have difficulty regulating the amount of blood in their system. So they don't have enough, which is why one of the interventions that doctors will use, again, this must come from a doctor, not from us, is to tell people who have POTS to increase their salt intake as much as they need. Some people with POTS will even carry sodium pills with them to help manage their fluid balance. Venous pooling, we already talked about that. That's blood pooling in the lower extremities. Impaired cerebral blood flow. Blood's in the feet, it's not going to the brain. That's a problem. That is registered, all three of those are registered as stressors by the autonomic nervous system, which is going to keep that cranked up. We know when our autonomic nervous system is cranked up, we are not going to get good sleep. Our circadian rhythms are going to get disrupted. We're going to have more systemic inflammation. All these things we talk about with autonomic nervous system dysregulation and sympathetic dominance, people with POTS are going through. They may have autonomic neuropathy, where the body doesn't register as well what's going on with the heart and the blood vessels. They may have hyperadrenergic compensation. There's a type of POTS called hyperadrenergic POTS, which is characterized by the heart rate and blood pressure going way up, especially the heart rate when somebody stands. And their adrenaline and norepinephrine also going way up. They also may start flushing. It's almost like having menopause, God help them, when they are teenagers, because they stand up, all of a sudden they get hot, they start flushing, their heart rate's going like this. It's exhausting. And they have inflammatory and immune contributions. Because the sympathetic nervous system is in overdrive and there's not a break, because cortisol starts losing its ability as an anti-inflammatory, we see all of the things that we normally see with people who have sympathetic dominance, including systemic inflammation increasing in people with POTS. And it's just a worsening cycle. The worse the inflammation gets, the more the sympathetic nervous system's turned on. The more the sympathetic nervous system's turned on, the worse the symptoms get. Standing and extended sitting are both stressors. Upright posture, think about gravity. Upright posture shifts blood away from the chest and the brain and down into the lower extremities. Prolonged sitting, more than 15 or 20 minutes, such as in class, at work, or driving, also causes venous pooling, reduced venous return, so that blood goes down to the feet, but it can't get back up, and a consequent decline in blood flow to the brain. Sitting is often mistaken for rest when it is orthostatic stress in POTS. In POTS, sitting is not restful. If you're sitting, your body is still fighting gravity. Rest is being flat with maybe your feet slightly elevated. That's when your body can actually rest and go, okay, I don't have to it's almost like trying to suck a tennis ball through a straw, the way the body feels trying to get that blood back up to the brain. Brain fog occurs due to reduced blood flow to the brain and reduced oxygen delivery. We also know that when the sympathetic nervous system stress response is on, what's one of the first things that happen? Blood sugar, blood glucose, etc. are shunted away from the prefrontal cortex, where we do all of our executive functioning, our attention, our concentration, our learning, our organizing, our planning. All of that system basically shuts down and provides the blood sugar and oxygen and everything else to help us fight or flee. So in a person with POTS, that prefrontal cortex is really just struggling, screaming, hey, give me some energy back, which is why we see a lot of brain fog. It's as if they're in basically a persistent fight or flight state. We see slower processing speed. So in school or at work, if somebody has slower processing speed, they're getting it, but they're struggling. So instead of running the mile, they're walking it. We can't expect a person with POTS who is actively symptomatic to necessarily be able to come up with the answers as quickly. Things don't just roll off their tongue as easily because that prefrontal cortex is in a energy deficit. Reduced working memory. So things that they're learning start to go down. They start having trouble using their working memory. Executive dysfunction, attention, concentration, planning, organizing, out the window. Because the body says, you know what? We need to try to stay upright and keep the brain oxygenated and blood flowing. Not really worried about learning algebra right now. And word finding difficulty. A lot of us have had this sometimes, especially if you've had particular viruses where you get significant brain fog, and it's difficult to find your words. It's difficult to think clearly. Well, this is what it's like for somebody with POTS 24/7. Co-occurring conditions. A lot of people with POTS have something called hypermobile Ehlers-Danlos syndrome, which means that they have a lot more flexibility, which doesn't sound bad in theory. You're like, oh, cool. But it's bad because our tendons and our ligaments are supposed to hold us together. And for people with EDS, a lot of times their joints are extremely unstable, which makes it a whole lot easier for them to get hurt. The EDS also can impact the body's ability to return blood up to the heart and the brain. There's a high correlation between autoimmune disorders like celiac, rheumatoid arthritis, and lupus, and POTS. There are a lot of people with POTS who have multiple co-occurring physical conditions. They're not malingering. They are not faking it, for lack of a better word. They actually do have a lot of stuff going on, and most of it traces back to that dysfunction in the autonomic nervous system and persistent sympathetic dominance. 20% of people with POTS have fibromyalgia. Fibromyalgia is a pain syndrome. It does not necessarily include inflammation, which is why it's not categorized as an autoimmune disorder. But 20% of people have it, and it is extremely painful and debilitating. They may have mast cell activation, where they frequently, for no apparent reason, just start flushing, or they get hives, GI upset, especially under stress. These are the people who turn bright red in a moment's notice. High correlation between POTS and migraines and other chronic pain syndromes. When we are chronically stressed and serotonin goes down, and they found that people with POTS tend to have much lower circulating levels of serotonin than people who don't have POTS. But when serotonin goes down, our pain threshold also goes down. We actually do feel more pain. So a lot of people with POTS actually feel a lot of pain. They feel aching pain. It may not be stabbing pain. It's just aching joints. Everything hurts. There's a 21% to 48% correlation between chronic fatigue syndrome and POTS. It's not deconditioning. It is actually neurological swelling, neuroinflammation that is contributing to what's going on. So again, it can be very pathologizing, debilitating, and downright harmful to tell somebody to try to just push through, start reconditioning. They may be doing good just to sit up in bed. I know there were days where my daughter, if she could sit up in bed for 15 minutes, it was a win. That was absolutely a win for that day. People with pediatric acute onset neuropsychiatric syndrome and pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections, otherwise known as PANS and PANDAS, it's very common to see these people develop POTS later in life. 9 to 19% of pediatric patients with PANS also meet the diagnostic criteria for POTS at some point. They're not sure about why the connection, but there is a strong correlation between the two. If you're working with somebody who has a history of PANS or PANDAS, making sure their caregivers or they are alert to the possible signs of POTS is important. Thyroid dysfunction is very common, especially Hashimoto's thyroiditis, which is an autoimmune disease. But we also do see a lot of non-thyroidal illness syndrome, where because the body has been in fight or flight for so long, the thyroid system starts putting on the brakes by releasing something called reverse T3. So their T4 levels may be fine, their T3 levels may be fine, but if their RT3 levels, their reverse T3 levels are high, that's breaking down their thyroid hormones before they can actually stimulate the system. If you've got somebody with POTS who's got persistent fatigue, it could not just be, but it could be a symptom of the autonomic stress. However, it doesn't hurt to also make sure that their thyroid is functioning as well as possible and double checking that RT3 level. Long COVID is associated with the development of POTS. The past 2 or 3 years worth of research, I almost couldn't find research that didn't have the phrase long COVID in it. And I'm like, I want to talk about clean POTS, if you will, because POTS existed before COVID. And it's important to recognize that, yes, there are a lot of people that have ongoing problems after a virus, and one of those may be developing POTS. Again, as a result of persistent sympathetic nervous system activation and dominance, the body is constantly dumping blood sugar to help us fight or flee. It's constantly staying in that primed state, which contributes to the development of insulin resistance, which over time can increase the risk of diabetes. Now, for some people, POTS is intermittent. So they have flares and they have remissions. And that's not nearly as bad because the body can recover and become more sensitive to insulin during the remissions. But during the acute period where there aren't remissions, if that lasts for years, you may start to see the development of prediabetes. Just encouraging people to be aware of their blood sugar, how they feel after eating high carbohydrate meals, and whether they're having increased thirst, increased urination. Their doctor really should be monitoring their risk of diabetes. In terms of GI, immune, and metabolic contributions, eating redirects blood to the gut to support digestion. Makes sense. In POTS, the nervous system doesn't tighten the blood vessels, so too much blood stays in the gut and not enough gets back to the brain. So we still have this upward movement problem. The body gets it out of the feet. It's like, okay, I can get it halfway there. I can get it to the gut. But it gets to the gut and it can't get the rest of the way up. High carbohydrate meals worsen symptoms by increasing insulin and gut blood flow and reducing brain blood flow. So this is a new thing I learned, that high carb meals tend to draw more blood to the gut. Well, if the brain's already starving for blood and you're prioritizing blood to the gut, then yeah, you're going to see the sympathetic nervous system start to react and say, we got an imbalance here. Post-meal inflammation further destabilizes the autonomic nervous system and can worsen fatigue. In terms of physical impact, So what are we looking at? We're looking at somebody who, when they stand up, their heart starts to beat really, really fast. That's called tachycardia. They get dizzy. Well, when our heart beats fast and, we're generally breathing shallowly because our stress response is kicked up, we may start feeling dizzy. We may feel like our heart skips a beat some. Fatigue. They estimate that for people with POTS, it takes about 3 times the energy every time they stand as it takes for somebody who doesn't have POTS. There's sleep fragmentation because they're always in some sort of fight or flight state, so they're not getting that good restorative deep sleep. They're not able to relax very well. They have gut dysmotility and pain because the system's just not working right. And we know when we're under stress, our microbiome changes, our gut motility changes, we start having leaky gut issues, which contributes to more neuroinflammation. It's just a whole mess. Temperature dysregulation. People with POTS cannot regulate their temperature. They have this really narrow window. A lot of people with POTS have this really narrow window where they're comfortable. Once they start to get cold, they're freezing. Once they start to get hot, oh boy, they get hot really fast. Cold doesn't seem for a lot of people to be nearly as bad. They can put on layers and things. But when people with POTS start to get overheated, they get irritable really quickly. And in many cases, it's a really high risk trigger for fainting. We need to be sensitive to that at work, at school, in our offices. When people are sitting in our office, we need to make sure that they're comfortable. If they're starting to get hot, do we have fans that we can turn on for them? Do we have ice packs that they can put on their wrists? That helps a lot with regulating because your blood goes through your wrists, and putting an ice pack or a cold water bottle between your wrists can help regulate temperature a little bit in the short term. But those are 2 things that we can do in our office for somebody who has POTS who may start having an issue with temperature regulation. They have increased pain perception. It's real. They're not making it up. It's not because they're not moving enough. Their nerve endings are actually more sensitive to pain. They have reduced libido and altered gonadal hormones. Well, that naturally happens when our body is in constant stress. But we know that alterations of gonadal hormones also alter our neurotransmitters. So you're going to start seeing people experience more, potentially more mood issues because their serotonin's, in the basement and their adrenaline is up here, and GABA and glutamate have just kind of thrown up their hands and gone, I don't know which way to go. Weight gain. A lot of people with POTS gain weight. Many people with POTS were very active prior to getting sick or getting injured. And then all of a sudden, it's hard stop. So because they're not engaging in as much activity, they may gain weight. Plus, stress hormones, because that stress system stays on, favors fat storage. So every little bit they eat that's not used, like immediately or quickly, is stored as fat. So they're going to start almost being a magnet for fat. That is used for the long-term fight or flight. The body's trying to protect itself. And muscle loss also reduces our base metabolic rate and contributes to deconditioning, which makes it harder to do anything. So we've got to approach this systematically, gradually, compassionately with people. Inter and interpersonal issues caused by POTS. Loss of identity and ability to engage in their preferred activities. If this was somebody who used to enjoy running, hiking, physical activities, it's a hard stop on a lot of those things. But even for people who enjoyed more sedentary activities like painting, it becomes very difficult because they can't stay upright for very long. When their symptoms start to flare, when their blood starts to pool in their extremities. Vision starts to get blurry. It's more difficult. Once my daughter got her symptoms under control, she actually doesn't need glasses after all. She wore glasses all through high school. Now we find out that it wasn't that. It was the POTS that was contributing. And she doesn't wear glasses at all anymore. So we need to be sensitive to the fact that what people used to do, doesn't matter what it was, is going to be altered. And helping them grieve the loss of that is going to be important. Loss of self-efficacy and independence, especially before we get to the point where the symptoms are managed and they have their first remission, it can feel like it will never end. It can feel like nothing they do is helping. It's important to be curious, acknowledge the frustration, acknowledge the grief, and also acknowledge any small wins they had. Like I said, with my daughter, some days sitting up for 15 minutes in bed, that was a win for that day. If she actually came downstairs to do something, that was huge. That was absolutely huge. And I will tell you, she works 40 hours a week now, and she's gotten her symptoms under control, but it took years of different doctors and trying different things before she found what worked for her. Every person with POTS is a little bit different. There's guilt for not being able to ... not being able to do my laundry, not being able to keep the house clean enough, not being able to take a damn shower today because I just can't stand for that long. Yes, this is what we're talking about. We ended up getting her a seat for the shower, but there was a period there where she had to have somebody else wash her hair because every time she lifted her hands above her head, she passed out. She had really long hair at that point, and eventually she just got frustrated and cut most of it off. But, and that was her solution. She's like, well, screw it. If I can't take care of it, I'll make it so I can. These symptoms are not observable. So a lot of times people with POTS feel like they're being judged because they're not able to. And it's important for us as supporters to make sure that they understand, I get it, no problem. Let me help you. You do the very best that you can. And it's important for them to not try to engage in mind reading and assume they know what we're thinking. So we need to call them out on that sometimes gently to make sure that they're not assuming we're judging them. There's perceived inconsistency or withdrawal in relationships, leading to reduced credibility and rejection or isolation. If people don't understand what's going on with POTS, they may not understand why you've said, yes, you're going to help them move, or you've said, yes, you're going to go out on Friday night, then you keep canceling at the last minute. Helping them understand what's going on. And POTS, as I said earlier, it's an hour-by-hour thing sometimes. And you may feel fine at 8 in the morning, but by 10 in the morning, it's a whole different ballgame. And our significant others have to be willing to be flexible. And yes, that's asking a lot, but as a significant other, I can say, it's worth it. It's worth it. Authority mistrust due to repeated invalidation. A lot of people with POTS really don't like doctors at all because they kept getting misdiagnosed. They may not like, if they're children, they may have anger and resentment towards their parents, towards their teachers for not believing them, that they need to process. And caregiver belief and validation strongly predicts persistence and engagement. So not just saying, I believe you feel like you're tired, but saying, this must be exhausting. I can see that you're tired. I'm validating how you feel. I'm not just saying, oh, yeah, I get it. I'm saying, I can see it. I am validating. Emotionally, the chronic unpredictability maintains that autonomic threat. They get up at 8 in the morning, they're having a good morning, it's okay, but they don't know when that shoe's going to drop. They don't know if by 10 o'clock they're going to be flat in bed again. Anxiety and depression can develop as a result of symptom flares and difficulty with management, or the things they've got to do to manage it that conflict with what they want in their rich and meaningful life. Likewise, some of the medications that may be prescribed for POTS can be extraordinarily sedating. And it's really important to work with your doctor and make sure that you're doing as much as you can to tailor your treatment plan to maximize your quality of life. People may be worried that they're going to develop additional disorders. I went down that whole laundry list of co-occurring issues. So people who had an injury or an illness, then developed POTS, they may be worried they're going to develop celiac, they're going to develop fibromyalgia, they're going to develop fill in the blank. It's a real concern. However, helping them focus on the fact that right now, that's not going on. And there's a lot of things that could happen. What's the probability? What's the likelihood that if you follow your treatment plan and that things are going to get worse, that you're going to develop these co-occurring issues, and have them focus on FitCat as much as possible, that mindful facts in this context at this time. At this moment, do I have fibro? No. At this moment, do I have celiac? No. Okay, great. Then this is a great moment. Increased emotional reactivity reflecting physiologic overload. If the person's sympathetic nervous system is already halfway engaged because of all the POTS stuff, then when something happens, they're already stressed out, basically, physically stressed out. When something happens that stresses them emotionally, they can go from what looks like 0 to 250 because the nervous system just goes into overload. Diagnostic delays contribute to shame, hopelessness, and learned helplessness. All things that we can work with for people. Emotional distress contributes to ANS, autonomic nervous system instability, and sympathetic dominance. Grief related to POTS is chronic. There's a lot of stuff. Occasionally, new things will creep up that they're going to grieve, like realizing, hey, I'm at that time in life when I thought I was going to be going to college, but no, I guess that's not happening now. So it's a new grief, even though they've had the symptoms or they've had the disorder for a while. It's nonlinear. Well, grief is never linear. And it's triggered by reminders of limitations and potential flares, especially if they've been in remission and then all of a sudden they have a significant flare. It can feel demoralizing. People with POTS require acknowledgement, not minimization of what's going on. Cognitively, we see brain fog and slowed processing, reduced attention and or increased irritability, especially with standing or prolonged sitting. They have difficulty multitasking. Well, multitasking takes a lot of energy from that prefrontal cortex. And the prefrontal cortex is already starved for energy before we even start doing anything at all. Encouraging people to keep tasks singular, keep it simple, and set boundaries and limits. Performance fluctuates with posture and energy. Effort does not necessarily equal performance. They may be putting in 1,000% effort and only getting 20% performance because that's as best as they can do that day. Symptoms typically worsen as the day progresses because we start seeing them get more tired. We start seeing more stress on the body. Most of us get more stressed and irritable as the day goes on. And recognizing that as the person gets tired, those symptoms may become more prominent. Encouraging them to plan their day around that is also important. And obviously, this can be extremely developmentally disruptive for adolescents because it's going to thwart some of the things that they can or wanted to do. In terms of interventions, there are some things only a doctor can safely prescribe, like adequate fluids and salt, compression garments, postural strategies, different ways to sit, stand, lean, lay in order to address symptoms, exercise, and using transcutaneous, that means through the skin, auricular, that means the ear, vagus nerve stimulation. There are devices now that can be worn that can stimulate that vagus nerve and downregulate the stress response some. Now, it's not a magic bullet. It's not like something you're going to put on and turn it on and all of a sudden, I feel great. No. What it does is it helps start activating that vagus nerve so you have the ability, you have a chance of downregulating. In terms of vagal tone enhancement, helping people engage in activities where they increase their heart rate a little bit, and then they intentionally, either with a pulse ox monitor that you put on your finger or a watch or a polar heart rate strap, they intentionally slow their breathing and watch their heart rate go down. Doing that is actually activating the vagus nerve and strengthening its ability to respond and turn down the stress response. Temperature regulation. As I mentioned, cold water bottles can be helpful, dressing in layers. Sleep quality and circadian rhythm stabilization, super important. Poor sleep quality, poor circadian rhythms are going to increase stress. Encouraging them to consider an anti-inflammatory diet and discuss it with their doctor, including looking at how sensitive they are to gluten and looking at a FODMAP diet, which removes a lot of things that may trigger inflammation. Considering eating prebiotic, that means high fiber, colorful fruits and vegetables. Those are all anti-inflammatory. And probiotics, which is like kefir, yogurt, sauerkraut, kimchi, anything that's fermented can help improve the gut flora, which can help to some extent improve what's going on under the hood. Interpersonally, educate significant others about POTS and what declining invitations means. It doesn't mean I don't want to spend time with you. It means that I'm afraid if I do something, go out or something, I am going to fall out or I'm going to worsen my symptoms. Change activities or use a flexible schedule. Maybe you don't go bowling anymore. Maybe they come to the house and you watch a movie. It's not the same, but you're getting the social interaction. I'm not saying I don't want to spend time with you. I'm saying I can't handle going and bowling a full game. Help people learn how to assertively communicate their needs and balance the can'ts with the cans. I can't do this. Assertively communicate that. What I can do is this. So I can't come down and sit through an entire family dinner. What I can do is, what is it that you can do to try to meet the person part of the way? Encourage people with POTS to separate their self-worth from what they can or cannot do and help them define their rich and meaningful life so they can take stock of what is worth their very limited energy right now. What is it that is important for them to focus on? Because none of us has unlimited energy, but for somebody with POTS, they have very, very limited energy, and they have to think carefully about how am I going to use that? It's as precious as gold. We want to help them develop downregulation skills, again, to turn down that sympathetic nervous system. Teach them cognitive behavioral therapy skills to address catastrophizing, self-blame, personalization. Address mind reading, both them thinking they know what other people are thinking, as well as them thinking that other people know what they need. We need to encourage open, honest, actual dialogue. CBT can also help with all or nothing thinking and minimizing the positive, i.e. focusing on the negative. Encourage them to use FitCat for ruminations. Facts in this context at this time. Yes, in an hour it could be different, but what's going on right now? Using acceptance and commitment therapy tools like living in the and. I can have POTS and fill in the blank. I can have POTS and go to my kid's recital. I can have POTS and be a good parent by. Encourage them to unhook. I'm feeling defeated. I'm feeling powerless. Well, I have this feeling that I'm powerless right now. What am I going to do with it? So instead of saying I am powerless, saying I'm feeling powerless. Now, what am I going to do with it? And eliminating dirty discomfort. That means feeling angry about being anxious. Stacking distressful feelings on top of distressful feelings. Encourage them to use cognitive pacing and task chunking in order to not get to the point where they're completely overloaded and dysregulating. And provide trauma-informed care for their experience of medical invalidation. Environmentally, encourage them to move every 15 to 20 minutes and potentially use isometric exercises when sitting. This is something they can talk about with their doctor, like squeezing their glutes or shaking their feet can help move that blood around a little bit. Encourage them not to cross their legs when they're sitting. Make sure that they're aware of their standing, seated, or reclined options for getting through the day. If it's in group therapy, what can they do? They may need to lay down or recline during part of group in order to just stay cognitively present. It's not that they're exhausted, it's that the blood's not getting to their brain. Elevate legs when possible, even when they're sitting in group. If you have footstools that they can elevate their legs, that may help some. Encourage hydration and nutrition access. Make sure they're aware of ways to control their temperature, such as being near fans, having ice packs for their wrists or cold water bottles, dressing in layers so they don't get too cold or too hot. They can ask for flexible schedules for testing, schoolwork, and work conditions. And they can find out more about that at askjan.org. They have an entire page on reasonable accommodations for people with POTS. Avoid reaching overhead if that's a trigger. Use those little grippers to grab stuff off the top shelf. Use shower chairs and seated vanities when you're trying to shave or get ready. If needed, add grab bars by the sofa, bed, toilet, anywhere where you spend a lot of time sitting or you're going to have to get to a standing position. Minimize activities that require excessive standing during flares. Don't plan on cooking Thanksgiving dinner and being on your feet for 4 hours if you're in the middle of a flare. And for some, they find sleeping on the wedge can be helpful. POTS is a disorder of the autonomic nervous system. It's frequently misdiagnosed as anxiety, depression, ADD, or laziness. Misdiagnosed. Addressing the underlying pathology contributes to improvement of primary symptoms and prevents the development or worsening of secondary disorders. Environmental, supportive, and cognitive interventions can help reduce unnecessary stress and assist the person in focusing on physiological rehabilitation. Are there any questions? Job 206, yes, there is some research and some experience that says that for people who develop it during their teen years, symptoms become much more manageable and sometimes less intense as they exit puberty, as their gonadal hormones and everything else stabilizes. Growing up, bones, ligaments, tendons, everything is stressful on the body. So once all that's over and everything is steady state, there is a fair amount of information that says for a lot of people, not everybody, it improves or gets better. I know my daughter, if she goes through something that's extremely stressful, she may have a flare and be in bed for a couple of days. But most of the time, she is working 40 hours or nearly 40 hours a week and able to manage what's going on with her and seems to be in relatively good spirits. She's married and lives with her husband, so it's not like I see her every day anymore. But the change has been absolutely dramatic since she turned, mid-20s. And again, Job 206, I am speaking from what I read in research and from what I've seen in personal experience. But everybody who has POTS has a slightly different experience. If you've got POTS, I strongly encourage you to reach out to some of the universities that are near you to see if they have any clinical trials going on. The Vanderbilt POTS Center here in Middle Tennessee was a lifesaver, literally, for us. Tammy, to find specialists who diagnose POTS, again, look for there are specialized POTS clinics or clinics that specialize in dysautonomia, dysautonomia, or problems with the autonomic nervous system. I would start by searching for that, but you can also look at universities that have a clinical trial going on or have a program specifically designed to address that. I know they have them in multiple states. It's not just here at Vanderbilt. I do have a couple of videos that I did on POTS about 5-6 years ago. So research is not up to date, but they are on the YouTube channel if you want to kind of scan through and see if there's anything else that you can learn about it. But yeah. Alrighty, everybody. Thank you so much for being here. This topic, as you can see, is near and dear to my heart, and I look forward to seeing you next week.